So Danilo, my friend Jordi is already upstairs. He looks calm, he looks relaxed. And how long do you think he's gonna take the surgery?
Actually, it depends. It may take around 7-8 hours, more or less.
7-8 hours, the whole procedure?
Yes, whole procedure.
So from they got the analysis of the blood test, and then they got the...
Let's say from the starting of the surgery, so when they started doing the anesthetic, then it will take around 7-8 hours.
Okay.
You know, of course, during the surgery, he has break, he can have lunch, he will have like time for enjoying his break. Maybe if he needs to go to the toilet or check his phone, he can do it, no problem.
So everything. So if he needs to talk or to stop for a bit, he can say, listen, I need to...
He just needs to raise a hand, just okay, hold on 1 second.
And that's it. And now, what are the steps? So first is the anesthetic?
Yes, first anesthetic, then they give us a massage, like around 10 minutes, just to make the anesthetic go on. Then they will start taking the graft with the micromotor. I showed you all the, instruments in the room. So they will take the grafts with the micromotor, then they will select the grafts, they will choose them, then there is a technician doing the incision on his head, the channel opening part, so we call it channel opening part.
Yeah.
There is a technician doing the incision, then after that there is other technicians implanting the graft.
Wow, so how many people is around? I've seen upstairs there were like 4 people, 4
people. Even a bit more, because there is the technician, then there is the chief of the technician, the team leader, there are the technician that are taking the graft, the technician doing the selecting the graft. Yeah. So there are many persons in one room. It may be like around 7 persons in one single room.
Wow, and I mean, I'm not saying that I'm scared, but it looks quite. Does it hurt? I mean, does it feel?
Well, as the doctor says, it's like going to the dentist. You feel pain like around the first 15 minutes. It's a bit uncomfortable for the anesthetic to start having the effect. But after that, it's okay.
And what about after? What about after the surgery? And what are do they feel something? Is it painful or?
Well, after surgery, it's not painful, but maybe the first few days it will be a bit itchy, a bit redness, because of course we are doing many incisions in the head on the skin of the patient. As you can imagine, if we take, for example, 4,500 grafts, we make 4,500 incisions for taking the graft and 4,500 for implanting the graft. So maybe the first days it will feel a bit itchy or a bit redness as well, but it's not painful itself.
The coffee's here, huh?
The coffee arrived, so we can start again. So just a bit of energy and then we can start again.
Exactly.
Okay, so you were asking something about right away after the procedure?
Yeah, because when you finish the procedure, I mean, it's a little bit that you were mentioning, it's itchy, it's been a few injections inside and everything. What is the next step? What do you have to do? Do you have to look after like in a specific way, and any shampoo that you can use, or how you do it?
Well, actually the procedure is very simple, it's very easy. After the surgery, we will bring the patient right away to the hotel. He needs to sleep in a certain way. Well, of course, after the surgery, we give some information to the customer on how to sleep in the first night after the surgery, what kind of medicine to take right away after the surgery. Or
I guess it's a lot of plenty of vitamins and.
Well, actually, the more important is like kind of antibiotics the first day after the surgery.
Any infection or anything?
Yes, just to avoid this kind of stuff. So after the surgery, we give to the patient some information for the first night. Then the day after, the patient is coming here again. He will have the shampoo, so first wash, medication, a control with the doctor. After all these steps, we give to the patient some information about the vitamins that he has to take. We will take the pictures for just, as I told you, make a comparison. Before and after. And
the shampoo that you put, you have to do in a certain way. You teach it.
Of course. We teach.
I figured that is a certain way to do it.
Yes, of course. We teach to the patient how to do. So there is a certain way to do. We just put a foam. It has to stay there for 25 minutes more or less, 25-30 minutes more or less. Then we rinse the foam. We do the wash in a certain way. The technician are doing the shampoo to the customer. Then of course there is a translator that is going to give all this information to the patient as well.
It's crazy because I've seen that you guys how many languages? I've seen all the paperwork and everything for so many languages. So everybody comes from around the world, right?
Yes, we have customers from around the world.
That's
so
great.
we need, as I told you, we need the patient to feel like he's home, actually.
Feel comfortable, fantastic.
So we are trying to speak as many languages as possible and to give all the information in the correct way for the customer to be easy for him to understand.
Fantastic. When they finish and you send them home and they arrive in home, how they contact you? Do you have someone they can ask questions? Because I guess a lot of people, I'm not doing it right. Do I have to do something different?
Yes.
How they do it?
Of course, we have a post-op department. They are just in charge of all the steps after the operation.
Okay.
We have some people there here at the clinic. They answer on WhatsApp, by email, doing phone calls to the customer. Because if the customer has some doubts or questions, he can just speak with them directly.
Oh, fantastic,
And
fantastic.
for them, they speak in many languages just to make the patient express his doubts or make his question and feel comfortable when he has his answers.
And
Everything.
there is no magic, of course.
Thank
There is
you.
no magic. It needs to have it.
Of course, the result of a surgery, it's not the clinic itself. Of course, the clinic is a big, it makes a big role in the surgery, but it depends, of course, on the customer after the operation, what is he doing, if you take care after the operation. As I told you, for the first 15 days, he needs to pay a lot of attention to the first half. So, no drinking alcohol for the first 15 days. No coffee for the first 10 days.
No coffee?
Wow. That's a bit hard.
Yeah, I didn't know. I expect the alcohol, of course, but I didn't know that the coffee also could make
or
difference.
tea. You know, for us Italian, Spanish.
Yeah, that's why I'm with my coffee here.
Yeah, for example, my Turkish coffee is
That's good, fantastic.
It's a bit hard.
Yeah, I figured, but I wasn't expecting. Oh, it's great. Well, thank you. How many people comes here to the clinic?
It depends.
If you can, I guess it depends of timing during the year. More some period, maybe probably in winter.
It depends on the season. Yes, let's say that the very hot season for hair transplants starts in September and it's over like around the end of March because it's seasonal.
Yeah.
But of course, even during summer, there are many customers that can enjoy their holiday and they just
I guess it's summer for us here, European, but probably in other places it's winter, so they can manage that.
Yes, of course.
That's good. Well,
but don't think about this because a lot of Italian, Spanish, they come here for the transplant in summer because maybe they have that 15 days of holiday that they use for the transplant. Yeah. So they're using summer. Of course, during summer you need to pay a bit more attention
to the sun and everything.
The sun, the hotness. You cannot go to the beach for the first month. After the first month, even if you're
something
going
to
yes, you need
to look at it.
Pay attention because as I told you, yes, the first month is very important for the final result of the surgery.
Of course.
After the first month, you can go back to your normal life, to your routine. But for the first month, it's very important that you follow all the instructions. How to wash your hair, how to to basically live your life. So no sport for the first 1 month, no sunbathing, no direct sun on your skin. So this is very important. Very, very important.
Wow. That's great. I mean, I feel that I could do I'm fortunate that for the moment I don't need it, but it's good to know all these things and to have all the information. And my friend was very happy to come, to enjoy the whole experience. I mean, you guys have looked after him very much, and yes, looking forward to see the result. And I'm sure that he's gonna be very happy when he see the hair just growing and that.
That's for sure. Well, actually, the transplant it doesn't have to be only the surgery itself. It has to be an experience.
Yeah.
Okay, that's why they come here. They enjoy the whole experience with people around them, trying to feel them comfortable.
Yeah.
They have to feel like they're home.
Yeah,
that's why I told you. Of course, they are anxious before of the starting of the transplant. Then they cannot wait for having the results.
I was actually excited, and I wasn't doing the surgery, so I can imagine the people when he comes here. So, but yeah, it's been great. So thank you very much for the info, and looking forward. Let's see how he ends.
Yeah. It will be everything fine, of course. As I told you, we'll give him all the information after, so no problem. We'll take care. Okay?
Fantastic. Great.
Thank you, Luis. It was a very nice time.
Thank you very much.
Enjoy your coffee.
Thank you. You too.
Thank you.